Welcome back. In today's lesson, we'll explore co-occurring disorders, the relationship between depression and other mental or physical health conditions, such as anxiety, substance abuse, and chronic pain. It's important to understand that depression rarely exists in isolation. For many people, depression is accompanied by other conditions that can make diagnosis and treatment more complex. Let's start with depression and anxiety. Depression and anxiety are often closely linked. In fact, anxiety disorders and depression are two of the most common mental health conditions that people face, and they frequently occur together. Studies show that around 50% of individuals with depression also experience an anxiety disorder at some point in their lives. So why are these two conditions so often found together? Well, depression can create a sense of hopelessness and helplessness, which leads to excessive worry and fear. Anxiety, in turn, can heighten feelings of unease and nervousness, making it even harder for someone with depression to cope. On the flip side, the stress and constant worry that comes with anxiety can contribute to the development of depression, creating a vicious cycle. People with both depression and anxiety might experience restlessness, irritability, trouble sleeping, and difficulty concentrating. The emotional and physical toll of managing both conditions simultaneously can be overwhelming. When someone is experiencing depression and anxiety together, the typical treatment approach is a combination of therapy and medication, often involving cognitive behavioral therapy, CBT, to help individuals manage their anxious thoughts, and antidepressant medications to stabilize mood. Reflection questions. I think depression and anxiety feed into each other, making it harder for a person to manage both. What treatment approaches do you think would be most effective for someone dealing with both anxiety and depression? Now let's move on to substance abuse. It's unfortunately common for people struggling with depression to turn to substances as a way of coping with their emotions. Whether it's alcohol, drugs, or even prescription medications, many individuals with depression self-medicate to numb the pain they feel. Substance abuse can be both a cause and a consequence of depression. For example, drinking alcohol or using drugs might temporarily relieve feelings of sadness or hopelessness, but in the long term, these substances worsen depression. The alcohol-induced highs might seem like a quick fix, but they are often followed by a crash, intensifying the depressive symptoms. Similarly, drug use can lead to an increase in feelings of isolation and shame, which can make depression even harder to manage. In turn, depression can make people more vulnerable to addiction. When someone feels emotionally numb, they may seek substances to escape their reality. This makes depression and substance abuse a dangerous combination, as the two disorders feed into each other, creating a cycle that is difficult to break. The good news is that dual diagnosis treatment, which addresses both depression and substance abuse simultaneously, has been shown to be effective. Programs that combine therapy, medication, and support groups can help break this cycle of self-medication and help people recover. Reflection questions. How does substance abuse act as a coping mechanism for those with depression? And what are the long-term consequences of this? Why is it so important to address both depression and substance abuse when treating someone with these co-occurring disorders? Lastly, let's talk about the relationship between depression and chronic pain. Chronic pain is another condition that often overlaps with depression. People with conditions like arthritis, fibromyalgia, or back pain often experience depression as well. In fact, research shows that individuals with chronic pain are at a higher risk of developing depression, and vice versa. This is because pain and depression share many similar pathways in the brain. The constant struggle with chronic pain can lead to feelings of helplessness and hopelessness, which can in turn lead to depression. Similarly, depression can make chronic pain feel even worse, increasing the perception of pain and lowering a person's pain tolerance. The two conditions can create a feedback loop. Chronic pain makes depression worse, and depression increases the intensity of pain. When dealing with both chronic pain and depression, it's important to take a multidisciplinary approach to treatment. This could include a combination of physical therapy, medication for pain management, and psychotherapy to address both the emotional and physical aspects of the condition. Cognitive behavioral therapy, CBT, is particularly effective in helping individuals cope with both depression and chronic pain by teaching them how to change negative thought patterns and develop coping strategies. Reflection questions. How do you think chronic pain can exacerbate feelings of depression? And how can depression increase the experience of pain? What treatments or strategies might help someone cope with both chronic pain and depression at the same time? To summarize, depression rarely occurs in isolation. Many people suffering from depression also struggle with anxiety, substance abuse, or chronic pain, creating a web of complex challenges. Understanding how these co-occurring disorders interact helps us provide more comprehensive and effective treatment. In the next video, we'll explore how gender plays a significant role in the way depression is experienced and expressed. Let's keep it going, and I'll see you in the next one.